This is a question about hormone replacement therapy. Is hormone replacement therapy dementia protective for women over 55?
Oh, over 55. Okay, so let me take a step back. So, hormone replacement therapy to me means the use of estrogen and or another hormone like progesterone for women as they go through either the perimenopause transition or when they're postmenopausal. So, I'll take another step back. I have learned more about this topic, which I can give a shout out to Maria Shriver, who was responsible for me buying the shirt at Macy's in Pasadena back in 2015, but also was responsible for saying, Isaacson, why do more women than men have Alzheimer's? Why are two out of every three brains affected by Alzheimer's women's brains? Why is it, Isaacson? And she jabbed me, and I said, I don't know. They live longer. She said, Isaacson, figure it out. And that's what we did. And we spent, $10 million dollars on a brain imaging research project and all the stuff we're doing now at ind.org. So I have a lot more education on this. So when a woman goes through the perimenopause transition, their estrogen drops. And in certain women that have one or more copies of the ApoE4 variant, that woman is at extra high risk of fast forwarding of amyloid deposition. So the perimenopause transition affects certain women more than others in terms of brain health. So it's a lot more standard, a lot more, I would say, commonplace that when a woman has perimenopause symptoms, night sweats, maybe some brain fog, variety of other things, that if a woman is symptomatic and their estrogen drops, then we can use hormone replacement therapy in combination with the treating GYN, primary care doctor. I'm a preventive neurologist. And what we do personally, I saw this question in the chat too. We look at estradiol levels and we try to, use hormone replacement therapy to one, make the symptoms better because we want women to live a higher quality of life. It's not just like, oh, I'm sweating at night, change the temperature in your room or get a chip cooling pad on the, maybe that'll help too. But no, this is a neurological problem. Perimenopause is a neurological problem. It's a real condition that needs to be treated. And there are too many doctors that just still don't get this. And I hate to say it, I was one of them 25 years ago because that's what I was taught. Night sweats, change the temperature. No, treat the hormones if someone has perimenopausal symptoms. So in someone who is perimenopausal in their late 40s and early 50s, I think it's pretty common or much more common for women to be prescribed hormone replacement therapy. We recommend generally, I'm not your doctor, please talk to your doctor, bioidentical hormones. We tend to use patches better than pills because it's slow transdermal bioidentical estrogen can get absorbed. We then track the estradiol in the blood every few months, and then we track for symptoms and we try to level it out. All the units are different. We use the Boston Heart Labs, whether it's 50 is the low target or 40 or 60 of estradiol. I don't know, everyone's a little bit different, but that's something we look at. We look at the symptoms, the clinical and the biological, and how the person feels. Are they sleeping better? Do they feel better? I believe that using hormone replacement therapy, this is my personal opinion and based on, evidence, that is coming around, that longer term use of hormone replacement therapy is protective on women's brains. I was taught that, after 5 to 7 years or 7 to 10 years, women have to stop hormones because of, this risk and that risk and that risk. And I'm not really sure that that is correct because, the studies that were done in the past weren't bioidentical. There was let's get the hormones from horse urine and let's test it in the 90s. And then let's publish a paper in the 2000s. And then 20 years later, we're still thinking the same thing from a study that was done decades ago. So when you use these bioidentical hormones, and in our research study, we showed, my team at Cornell, that I was a part of and recruited patients for, the women that had estrogen replacement and hormone replacement therapy on board, their brains looked better. Their brains didn't age as much. They didn't have as much atrophy. They had less amyloid protein. And we had women into their 60s, into early 60s that were still on hormone replacement. So the take home question, and the question was, what about hormone replacement therapy for women 55 and above? Talk to your doctor, but I'm generally okay with it. I think the other thing is, we just presented these data at the Alzheimer's Association meeting, and our youngest woman was 42 years old, and our oldest woman was 67 years old. And two of these women that we've tracked before and after starting hormone replacement therapy, two women, one was 60 and one was 67, and we're just starting another woman. So we now have about three women that have been started on hormone replacement therapy in their late 50s or later. And that's That's new. That's the thing. And you know, if all the doctors were aligned. So the take home point is we don't have sufficient evidence to be definitive about this. But in our recent study that we presented, not fully published yet, but we presented this at the Alzheimer's Association International Conference 2025. It showed that we had improvements in brain marker proteins like the tau protein after a woman starts on hormone replacement therapy. And that's, I think, the answer here. So if you're a 55-year-old woman looking for answers, talk to your doctor. But one day we're going to have this cholesterol test for the brain. It'll be out there. If you want to learn more, you can sign up at ALZLabs, ALZLabs.org. You can learn more there. IND.org is doing a lot of great blood biomarker work, and retainyourbrain.com also in the chat to learn more about this. There's tons of content about HRT. But yeah, I believe that HRT is amazing and needs to be used responsibly and at the right time, at the right dose, and the right woman, and have the right doctors paying attention.